social worker. I have a master's in social work and a master's in public administration. So I thought it would be helpful today to talk about just kind of the overlap between different community resources and how those can become more available to us as individuals in this community through the advocacy process. And also I just want to use this time in the most useful way for all of you. And so if you have questions about certain things, or I'll kind of try and breeze through slides, and if you have questions at the end about something I didn't talk about, feel free to ask and we can kind of have a conversation. Like I said, I want this to be useful for you. So I'm a social worker with the Muscular Dystrophy Association and work really closely with the UPIN team here, and hopefully something I say today can be useful and helpful for you. Any questions so far? Should I just ask that after every slide? How many of you in here are have a neuromuscular disease yourself? Okay, and then the rest of you have a family member, I assume, with a neuromuscular disease? Great. Okay, so let's talk about, first we're going to briefly breeze over like the Social Security system, because anyone who has a neuromuscular disease either probably knows someone or has themselves had interactions with the Social Security system generally. And I think that it's a confusing system and can be a little bit overwhelming. So I'm just going to give you kind of a brief overview of what that system looks like, how it can be useful or helpful for you, okay? So there's all these S words, all these S acronyms. Let's just kind of go through them. SSA is Social Security Administration. That's just the governing body that manages all the Social Security programs and problems. Yeah, mostly problems, actually. SSDI is Social Security Disability Insurance. It's the program that you draw on. Essentially, you take out your Social Security early. So you can qualify for Social Security disability early in your life before you turn 66 and a half, which is the current age to take out your full Social Security benefit. And then SSI is Supplemental Security Income. It's the income that you can qualify for. It's income based, so you have to make below a certain percentage, and it's really low. So basically, it's the income that you can draw on from the federal government if you are unable to work.
So it's Medicaid?
They're separate programs, but yes. So okay. Social Security and Medicaid are tied together. Medicaid is the federal health insurance that often comes along with Social Security or supplemental security, but not always. Okay. So these are all Social Security programs, and then attached to them, which we will also talk about, is Medicare and Medicaid, the governmental insurance programs. Yeah.
You said you have to be unable to work to qualify for SSI?
The income threshold is so low for SSI that more or less. Some people do work very nominal amounts, but you pretty much are unable to work to qualify for that. Yeah, and it's really low. The amount that you get is not a lot, but a lot of times our families and patients use and depend on that SSI. Parents who have children who have neuromuscular diseases can also apply for supplemental security income if you're below a certain income threshold as well. Okay, so we talked about this. I kind of just breezed through these actually. Does anyone have questions about those programs so far? Okay, they're confusing sometimes. So, so this is the SSI. We talked about it. Yeah, I think I kind of brushed over it. There's like some complexities about each program, but I think the idea here is that you get the general gist of what each program does and how you qualify for it. So SSI income based, and is the you more or less don't work to get it, and it often comes with Medicaid, which we'll talk about. SSDI, the big thing with SSDI that a lot of people don't know about, and a lot of times is problematic for our culture here in Utah because we have a lot of moms who don't work, or parents who don't work. We have a stay-at-home parent. Is it does require work credits, so you do have to work the equivalent of about 10 years to get your full SSDI benefit. Yeah. Yeah, so as long as you're paying into the Social Security system. So if you're self-employed, you're paying your part of the tax and what your employer would pay. So typically when we're paid, we get part of Social Security taken out of our paycheck. That's one of the big federal taxes that's taken out. And then your employer also pays for a portion. But when you're self-employed, you're paying for both. But yes, so that's a big reason. And I laugh sort of sadly at people in my generation who are doing a lot of like freelance and kind of self-employed, but are kind of like evading taxes, et cetera, and whether Social Security will be around or not when I'm of age to receive it is up in the air, but in the meantime, it is important to know that to access your SSDI benefit, you have to have a work history. We have a lot of young, early to young 20-year-olds who come in and hope for some sort of Social Security disability benefit who just simply don't qualify because of work history, and that's hard. They kind of fall through this gap. So that's the big thing to know with SSDIs. You have to have a work history. Again, work credits, you earn about 4 a year, and you need about 40 to receive your full benefit. So about 10 years worth of work, give or take. There's some nuances in there that are kind of unimportant, but if you have more questions about them, we can talk about it. If you don't have enough work credits, you have the option to apply for SSI, again, income-based, so you might not qualify. The other big thing about SSDI is there is a pretty long wait period to have your application reviewed. And it varies by office and by region. In Utah, it's about 2 years right now. So if you are considering applying for Social Security disability benefits, do so sooner rather than later, because you are going to have to wait for about 24 months for your application to be reviewed. And at that point, you may or may not be approved or denied. When you hear stories about people getting lawyers, disability lawyers, to help them get approved for Social Security, that's usually what they're talking about. But don't wait until you need it right now. It's going to take a while. And then even after you get approved, there's a mandatory 5-month waiting period before you'll start receiving actual payments and before you'll start receiving Medicare, which is the insurance associated with SSDI. So plan ahead if you're thinking about applying or helping one of your children apply or a family member. So auxiliary benefits are the benefits that you can receive through the SSI program if you have a child or dependent who qualifies. Again, there's a lot of nuances to this. It's not just black and white, as anything with the government usually is not. So if you have more specific questions, these are just kind of some of the nuances, right? So it can be dependent grandchildren or step-grandchildren or children or stepchildren. They have to be unmarried and younger than 18 or 19 if they're a full-time student. Spouses and ex-spouses who care for greater than 16 dependent children. Like there's a lot of like really, really specific nuances about how to qualify for auxiliary benefits. They make it really difficult. If you have specific questions about this, feel free to reach out to me. I put this up here because I want to talk a little bit about this. I think really plays into the advocacy piece. Social Security receives funding from a number of different sources, but the main source is payroll tax, which is, like we talked about, you pay a portion from your paycheck and your employer pays another portion, or if you're self-employed or a 1099, you're paying both portions. And there's a lot of talk right now about how we're going to fund Social Security in the future as the baby boomer generation, which is the biggest generation in American history, rolls into not contributing to Social Security but drawing from it. So there's lots of questions about how we're going to move forward and fund that. And I think it's important to note that not only does it affect normative, neurotypical individuals who draw upon this as a retirement income, it also affects our community because they draw on it for SSI and SSDI. So some things to think about. Questions about Social Security right now, or the Social Security Administration, the programs, anyone had experiences, good or bad? Yeah.
I worked till I was 63, and the company I worked for had a disability rider on their insurance, and it lasted for a maximum of 5 years. So at 63, I applied for that, and I was granted that. But they required that I apply for Social Security disability benefits, and they would make up the difference.
Correct. Right.
I didn't have to wait 5 months. It seemed like it was about 30 to 60 days, and then is it later than that, or is it more problematic now?
So what you're talking about, what's your name, Bruce? So what Bruce is talking about is he has a long-term disability insurance program through his employment. Some employers offer that as an option. You can opt into it, and essentially they'll pay out a portion of your salary, sometimes it's about 60%.
Yes, that's what it was.
Right, for an extended period
5
of time.
years.
Right. So when you're already receiving long-term disability, the likelihood that your application will get pushed through is quicker because you've already qualified for a long-term disability program, rather than just applying for out of the blue. When we talk about long-term disability programs, yeah, the long-term, I guess insurance, not program, the long-term disability insurance will pay, make up the difference. So like, right, you receive a portion from Social Security, the Social Security disability insurance, whatever that may be, $1,200, $2,300, whatever it is. And then the long-term disability insurance will make up the remainder up to 60% of your salary, is what he's talking about. But yeah, and then the 5-month waiting period is for access to Medicare specifically, before you can access Medicare, if that kind of clarifies. Does that help? Or,
Yes.
okay. Okay, great. Any other questions about it? That's also something to know, is how your potential short-term and long-term disability might play into your decision to, right, like it's really wonderful if you work for an organization that provides that as an option, and that's lovely when I hear patients that have that option. That's really helpful, I think, in a lot of ways. The big, I think, useful piece of Social Security disability is accessing Medicare, which we'll talk about as kind of the disabled and retired persons. I don't want to use elderly, but retired persons medical insurance, and it's a really wonderful insurance program. It's been a lot in the news lately with the upcoming election. So, okay, let's talk a little bit about this program, DPSD. Has anyone heard of this before? So this is a state program for persons with disabilities. It's a really great program that offers a lot of different resources. It's for both physical and intellectual disabilities, and then some other medical disabilities as well. Basically there's a waiting list to qualify for it. It's pretty long, and it does go off of medical necessity as well as time on the waiting list, so there's a couple different factors into getting on it. It starts when you're 18, but you can apply for the waiting list before you turn 18, and so I often encourage my families who have children who are going to have a permanent physical or intellectual disability to get their children on the waiting list, because you can apply for that before you turn 18. We'll talk a little bit about this. Again, these are like some of the brief points of qualifying for this program. Like any functional disability resulting in functional loss of 2 or more limbs, which will last for 12+ months. And that's one of the things that allows you to qualify for, including blindness also allows you to qualify for it. Yeah, so the illness or injury could occur at any age. You do have to be 18 and older, as we talked about. So this is kind of the process. There's an intake process with a DPSD caseworker. They kind of will send you like a notice of eligibility, and then they'll put you on a waiting list. You can, due process requires you to have the right to appeal the decision if they deny you. But after you're determined, you go on a wait list, and when sufficient funds are secured, which never happens, or when someone's removed from the DPSD program, either because of lack of need or when someone passes away, the spot opens up and it kind of just moves slowly through the process. There's a lot of different things it helps with, some financial pieces, rehabilitation pieces, home medical services, some funding for like home adaptations, different environmental adaptations. It's a really wonderful program that's very comprehensive, and I wish everyone could access it. Unfortunately, they have limited funding for it, so not everyone gets to get on it. Yeah?
What does that DPSD stand for?
Oh, good question. I just say DPSD all the time. And so, like, this is the problem with acronyms. Utah Services for People with Disabilities Program. That's what it stands for, that top line. Yeah. Actually, that happened to me in a patient room the other day. I used an acronym and someone was like, what does that stand for? And I was like, actually, I have no idea. I've just been saying the acronym for so long. So that's what it stands for. Yeah, so it's a, like I said, if you have not heard of this, I would go ahead and get on that. I'll have a little slide at the end that talks about, or that gives you the link to the website and the application. it's a great program. It's worth just getting on the list. You never know. Maybe we'll get a massive block amount of funding or something. Would be great. So this kind of talks about, I like to include the funding structure for these programs because I think it's helpful to know where this stuff comes from, because I think it allows you as members of the community to be a little bit more empowered in your ability to advocate for more funding or to advocate through the process. One of the reasons we have programs like this is because of the Americans with Disabilities Act, which has been passed in stages over the last 20 or 30 years. And that act is almost solely a result of advocacy work on behalf of individuals who have been affected with different disabilities or who are advocates for different disabilities. And there are a lot of other pieces in our community, legislation pieces that have been completely and totally implemented because of advocacy on behalf of members of the community. One good example is we have in the United States the ALS Registry Act. It was an act passed in 2008 by the George Bush administration, which provided congressional funding for and completely paid for an ALS disease registry, which allows us to track and learn a little bit learn more about ALS. It's a completely congressionally funded registry program. And that happened solely because of a couple of really prominent members in the ALS community. Another great example of that, and I use ALS a lot because it's a really well-known condition in Congress because of the advocacy that's going on around it. When you have Social Security disability, when you apply for Social Security disability, there's usually a waiting list. But for two illnesses, ALS and end-stage renal disease, there's no wait period at all because they're considered a compassionate allowance. Under the Compassionate Allowance Act, to end-stage renal disease and ALS, there's no wait period at all because of advocacy and because of individuals in the community who have kind of gone forward to talk about these issues with local and kind of up-the-line representatives. So I do like to talk about the funding piece because I think it's important for you to recognize that we do have power to implement some of these pieces and to provide feedback about some of these pieces of legislation when they seem sort of silly to us. Like, why is it 5 months? It was just because some legislator decided that 5 months was a good time. Like, there's no reason for it being 5 months waiting period to access